Okay.
I'm gonna sit right next to you.
Oh yeah, 4 shots.
Okay. So we're gonna go over Foley catheter kits and how to insert a Foley catheter. A Foley catheter indwelling means that once we place it in, we're going to inflate a balloon and it's going to stay in place. Versus a straight catheter kit, which doesn't have a balloon, and you just straight cath them, drain the urine, and then pull it back out. So that's the difference. But you kind of set them up the same way because the steps are the same. You want to clean, right? You want to lubricate your tip of your catheter, insert the catheter, and take it back out. So, and keep your sterile technique the whole time. So the straight cath kits, we can open those and play with those later, but we're going to work on the Foley catheter today. Now these are newer kits for me. We usually have a little bit of a bigger box, but when I opened it yesterday, it didn't seem much different. So forgive me if I pause for anything because they are a little different than what I'm used to. When you do a Foley catheter and actually insert it, your goal is to know why you're placing it, which you guys have had that urinary lecture, right? We don't just place it on everyone. We don't want a Foley catheter in place. We know that they cause infections if they're in too long. So it's only something that we would use if we really necessarily need it. A lot of times for regional anesthesia, for surgeries, things like that, you might use them, or even after surgeries for a little while until the patient's back up on their feet. Okay. Anything that you want to say or add to that before I feel like it's so weird to just jump in because usually we lecture before, so I feel like I'm out of my element. These are the cylinders, as you guys know, to empty out your urine and to keep them by the beds, by the bathroom, so you have them when you're doing your I and O. And you're going to start just like anything else. You're going to wash your hands, you're going to review your orders, you're going to make sure that you're have the right patient, and then you're going to bring your kit into the room. Everything you need should be in here. If your patient is soiled for any reason, then you would bring additional items like water and soap and maybe some washcloths to clean them first. A lot of these kits now come with Castile soap wipes, so you can use those. But if they're really soiled, you're going to want to clean them with a real like bath kind of stuff instead. Okay, so making sure your kit is sealed, right, like always. You're going to come into the room, you're going to explain the procedure to your patient. They don't know what a Foley is, so you have to tell them that you're going to put a catheter into their bladder. Please don't tell them it's going to be uncomfortable. It hurts, right? Like using the word uncomfortable is just making you look like you don't want to tell them the truth, which it hurts. So I'm going to try and minimize this. You might medicate them with pain medicine before that and let them know this is what's going to happen. And then just explaining how to keep it in and all that. You can do that afterwards because they're going to be so nervous they're not going to be listening to you. So don't bother with education until after you put it in. So you're going to wash your hands. You're going to introduce yourself. Check name, date of birth, and allergies. Most of these kits are latex free. Some are not, so you have to find out if they are allergic to latex. They might need a different one. It's one of the things in the hospital that still has latex in them. Okay, and then you're going to get your patient ready. So bed to your level. I'm actually right-handed. I don't know why I'm pretending I'm going to do this on this side. That's annoying. I'm going to come over here. Sorry. Okay. So this is going to be at the right height, right? Waist level, because it's going to be a sterile procedure. I'm going to move this over. Thank you. And I'm going to raise the bed up to my working height. All right, I am going to put the side rail down. Don't come over to this side because I do not have a rail up. I'm going to get a pair of gloves. Wash my hands, put my gloves on. All right, and then we're going to get this patient in a position. Now, if they're older, you may want to pull this up and keep them covered. Get a warm blanket, keep them covered. You'll see in the textbooks the old-fashioned stuff about like wrapping each leg, and if they really are that sick, or if they really are at risk for being cold, then you may choose to do that, right? If you're doing a quick procedure and getting this done and over with, just making sure the top half of them, their modesty form is like done is fine. I'm gonna pull this down just so that you guys can see and we don't have to make this bed. So I'm gonna pull this all the way down so you guys can see. But again, I would have them covered. We're gonna get their legs into a position. The mannequins are a little bit harder to do that with, so I understand. Over. Pull that out. You want your gown out because the betadine will get on it and then you'll have to change their gown. Okay, so they're in a good position. You want the feet kind of apart so you have enough working room when the time comes. Okay, so I'm gonna open up this kit. I'm gonna pull out my entire kit. Now the nice thing is that this little thing here has the education. You guys could read through it and look at it on your own time. I like to put this right here. This is good, and I'll show you why. These are the Castile soap wipes. So you're gonna open this up. There's 3 individual wipes in here. And you're gonna clean the perineum area. So you're gonna clean down the center and then to the sides each. So again, if you're doing a female, you're gonna hold the labia by going in and pulling up. So we're gonna go in and we're gonna pull up, and I'm gonna take my one wipe, I'm gonna wipe down the center and I'm gonna place it here. And I'm gonna take my next wipe and I'm gonna wipe down the side and place it here. My next wipe and place it down the side and place it here. Everybody see that? Okay. I'm gonna wash my hands. There's gel. I'm gonna take this over here, put it into the trash, and then I'm gonna gel my hands. I don't care which way you do it, one or the other. Okay, now that's clean, done. I don't leave my dirty trash here. And I also don't make little cute bags out of the Foley stuff because I don't have time. I've got to get the stuff done that I need to get done. Okay, so we're going to open the kit. Which way do we open it?
Away from you.
Away. This is a sterile procedure. So we're going to open this away from us. Open. Hold on, this bed's a little bit high. Sorry. Okay. We're going to open this away. And this particular kit, for some reason, the little sterile towel is on the top. You just got to work with whatever you got. Some of them come like that, some of them come underneath. You work with what you have. Now, this particular one I can see. Now, this is going to be on the outside, right? So I can touch this. But the sterile drape itself, I can't pick it up from here because that's going to be the center of my sterile field. So what I'm looking for is that little edge, which I see right here. Do you guys see that? So now I'm going to pick this up, and you have to be careful that it doesn't drag on here. So I'm going to pick it up, shiny side towards me, right? And I'm going to place this down. Did you see how I just did that? So I'm not reaching over my sterile field? Yep. Now, of course, the tip of it is not sterile anymore, is it? It's going to be up against him, which is totally fine. Now that's my sterile field for working. And I'm going to finish opening my kit. When I open this side, I like to turn my box so I have more room. Make sense? All right, the next thing that's going to be in your kit is your gloves. And you notice how I'm picking them up because I have to be careful not to touch anything in my kit. I'm pulling it from there. Coming over here so my back is not turned to my sterile field. And I'm going to put my sterile gloves on just like you guys know how. Okay.
What size comes in the kit?
I don't know, too small. That's what size comes in it.
Can we change it with the ones we have to they fit?
Oh, Gabe.
I mean,
What are you going to do in the clinical setting?
panic.
There you go.
I would never get those on these hands.
I know. You guys can stitch them out if you need to. It's fine. Okay. So I'm not going to do anything with it. I'm leaving it. And now I'm going to put this glove on. Okay. Just like you guys have been practicing putting on your sterile gloves. flip down, right?
Mm-hmm.
Okay, sterile gloves are on. Okay, now I can touch my kit, can I?
Mm-hmm.
Can't reach over it, but I can touch it. So now I'm gonna move my box over, and I'm gonna move this here so that they're side by side because I need working room. I would use this if I was catheterizing a male. And what you would do if their penis was there, you would just drop that like that. Or even like kind of scoot it in, right? Like whatever you need to do. We're not using this because this is a female, so I would just, this would have been in my kit, correct?
Huh?
I would just move this off to the side because I'm not using it. Please pay attention when I'm taking it off my field. I'm not reaching over. This is glove, sterile, sterile, sterile. And I'm also dropping it, not from this height, I'm just dropping it here. Okay, the next thing I'm gonna do is I'm gonna open up my iodine swabs and put them here. It doesn't matter what order you set this up, just as long as it's set at the end. So I am going to take off this little blue piece, which is always a challenge to do. And you wanna keep it in the box as best as possible, so that it doesn't get all dirty and it doesn't get all unsterile. Okay, and then I'm gonna take this and I'm gonna do what with this?
Put it over there.
Just drop it over here. Okay, then I'm going to take my normal saline. With my normal saline, I'm going to attach it here where I'm gonna inflate it. I'm gonna attach that there and I'm gonna leave it in the box. Easier said than done with these little boxes. Okay, and then I'm going to take this lubrication, and I don't care if you touch the plunger, sterile to sterile, right? And I'm going to take my little plunger and I am going to put it here in the corner, the gel, in the inside of the box on the bottom corner. Right where the tip lands is where I'm going to put it. So I wouldn't put it over here, I'm putting it over here.
But you
Okay.
don't need to do it for the purpose.
Yeah, don't do it for this purpose because we're not gonna put it in the box and ruin it. Okay, makes sense?
Uh-huh.
You can either put it back here, it doesn't matter, you're not gonna use it, so it doesn't matter. Or if you feel like you have enough room, I wouldn't put it here because I don't feel comfortable right now. I don't have any place that I could put it safely without it dropping. So I'm gonna leave it here. If I did, I'd just put it off to the side. It doesn't matter. Now I'm gonna take my box and I'm gonna put it back on here. Make sense?
Uh-huh.
Now I'm gonna bring it over here to the patient. Now, you'll notice that I don't do it this way because the back of my hands can get contaminated. So I'm doing it this way and being very careful to bring this box as close as possible to the patient. So far, so good? This hand is now going to become unsterile because I am right-handed, so my left hand will become unsterile. I am going to open the labia, and I like to rest my hand on the patient because you feel the bone in there. It's like, it's different. You'll start to get to understand. And then you're going to take your iodine swabs, which are already out. You have them here, and you've poured in your stuff. Sorry, I should have done that. I'm not used to having those. And then you're going to take your swab that has the betadine in here, dip it in your betadine, clean, drop. This I'm not using anymore.
Uh-huh.
Clean to the side, drop. Clean to the side and drop. This hand never moves. This hand is holding up the skin. If it drops, I have to re-clean her because it's holding it open just like the clean catch. Thank you. Just like a clean catch. We're trying to keep that open, right? Same thing. Now I'm going to take this little kit here. I'm done with it, aren't I?
Uh-huh.
And put it here. And I'm going to take the tip of my catheter. This hand has been sterile the whole time, correct?
Uh-huh.
And I'm going to put this in here. Making sure not to touch it with these fingers. These fingers are not clean. This is staying in place. Making sure not to touch it. I'm feeding it in. Feeding it in, feeding it in, feeding it in. On a female, you're going to feed it in until you get urine. Once you get urine, you're going to go in about another inch or two. Okay? Now it's in where I want it. Now I can hold it with my fingers. Because now it's in place and I don't care because it's not going inside her, so it doesn't matter anymore. You don't want to let it go because it'll come back out. Is this hand still sterile, by the way?
Yeah.
Yeah, it is, isn't it? But I don't care.
It's cool for you to touch the tubing with your non-sterile hand just to hold it, eh?
Yes, because it's not going inside.
All right.
Nothing else is going in her. Now, if I said, oh my gosh, I should have gone in a little bit more, I can't. Because I've already touched it. So you can't push it in more. You'll see people do that too. Like, oh, I wonder if that is like, oh, what kinked your, and then they feed it a little more. You can't do that once it's been on the patient, in the patient, anything like that. Okay, so I'm holding it in place with my left hand, correct? And now I'm going to take this and I'm going to inflate my balloon, which is the reason why I'm holding it. As you start to press to inflate the balloon, which you can't do here because you'll pop your balloon in the mannequin, so don't do it here. You're going to pretend to inject all of your 10 cc's into this. As I'm pushing, I actually let go and hold on to this green piece and do it. In the real world, if you don't, this will pop off and you'll get fluid everywhere and now you can't hold it in place. So I start to inflate the balloon. Grab on, finish my inflation, disconnect, okay? And now my balloon is in place and everything is where it should be. Some, like your instructions say to pull back and tag on it. You don't have to. If it pulls back on its own, it will eventually. It'll settle where it needs to settle, so don't worry about it. Okay, so now I need to fix this box, don't I? Should I touch everything? My hands are dirty. Remember how I had betadine on it? And so I'm going to take these off. And I am going to now attach this to the patient. Now, your decision based on your patient, whether you need another set of gloves or not. Because this is all non-sterile no matter what. There's no bodily fluid on here. So I'm suggesting that for the purposes of here and for the purposes of our demo, you're going to grab another pair of gloves and you're going to put them on. But in the real world, you don't always put gloves on right away because they're not dirty. It's not dirty. But because you guys are still new and still thinking about it, right, we're going to put gloves on. Then you're going to take this little piece off that came on your kit. And this little piece comes with two things. Sorry. It comes with an anchor, and it comes with glue to anchor it, so to speak. So this little thing that you open, you're going to clean the thigh. It's not really cleaning, it's actually making it sticky. So this is glue. You're going to glue the thigh. Doesn't matter which side. I mean, unless there's a rash or something stupid. Okay. And then you're going to take this and you're going to place it in. As you can see, there's an actual way that it goes in here. One side is thicker than the other. Can you see that? And this has also one side thicker than the other. And you're going to place that in there and you're going to lock it in place. That way it doesn't get tugged or pulled on and move anywhere. That's the point of it. For the purposes of here, you can take one side and stick it onto the leg. But in reality, you would do both sides. Okay? We good so far?
Yeah.
Okay. So now we're in. And we're going to take all of this and we're going to clean this off. I'm going to move this over here. I'm going to take this towel, and I actually like to wipe them because there's usually a little bit of excess betadine and you don't want that on their skin. So I usually clean them off. And then I'm going to take this. And I'm going to bring this over here. Now, this is by gravity, correct?
Uh-huh.
So holding it like this is a very bad idea.
Yeah.
We want to keep it lower than the patient. And you want to attach it to a non-movable part of the bed. So it would be nice if we could use the side rail because the side rail is long enough. But you don't want to use that side rail because it moves. A lot of beds will have like Foley hooks on them. Like this one right here has a Foley hook on it, which is nice. The problem is that usually when it's this close, the tubing gets kinks in it and loops in it, dependent loops in it, and you can't have that. So what is a dependent loop? Well, here's my Foley bag, and here's the loop of the catheter. I can't have it sitting like that. It has to always be do you see that? It has to be either on top of it or draining down. It can't be like this, because then the urine's just gonna sit in here. So I'm gonna place it on my Foley hook, or you could always bring it down a little bit farther, dependent on your patient needs. We're lucky in labor and delivery, we have a little hole right here that this clicks into, so it's always nice. I'm just gonna put it here for now. You can use this, and you'll notice there's no dependent loops the way I have it. You can attach this to the bed if the patient isn't going anywhere. The patient is very up and down. That's more of a fall hazard because they can end up like trying to get up with it. Some people like to put it under the leg. You know, the thing is that you have to worry about it breaking into their skin. So as long as it's right at this level, you can see that it's gonna drain. And there's no dependent loops. I'm okay with that, the way it is.
Yeah, kind of a design flaw of the bed frame there. It needs to be
I
a little-
know, right?
Yeah.
It actually needs to be further
See,
down
look
too.
what it's, see, look what it's doing.
I know.
It's gonna do that.
So that's why you have this green hook, so that you can hook it like this and it won't go anywhere. That's the point of it anyway. And you can move it up and down as you need to.
Cool.
So I would move it like that. And now it won't go anywhere.
So for this,
So everybody understand this so far up to this point? Okay, question.
So how the tubing's like up and then it goes down? So in real life, would we like?
The patient's gonna move. You don't have a mannequin. So it's not, think about that for a second. They're gonna be rolling in bed. It's never gonna be in the same position you put it in, so it's fine. As long as it's on their leg and taped to their leg, it'll be fine. Okay, so it's in, it's draining, no dependent loops. So for me, I need to know what came out, correct? What color, right? You can't smell it, so don't tell me odor. You can't smell it, it's a closed system. Okay, but I wanna know what color and what clarity. Is it clear, is it cloudy, is there like blood in it? What's in it, what came out? Also, how much came out? If I put this in for purposes of urinary retention, how much was in their bladder?
Probably a lot.
Probably a lot. At 500 mLs, once you get out 500 mLs, you're gonna have to clamp this tubing for a few minutes. And you can clamp it either with like a rubber band or hold it for a few minutes. And the reason is because when you drain the bladder and it's been over distended, if you drain it all in one, the bladder will spasm and cause extreme pain to the patient. You all know what I'm talking about when you've held it too long and you go to the bathroom and then when you're peeing it hurts for a minute. That's what they experience as well. So it's better if you clamp it at 500. Don't forget to unclamp it. So that's why I kind of stay at the bedside and watch. Okay, I'm holding that, I'm holding that. Okay, give it a few minutes and now I can unclamp it and leave it back the way it was. So you want to know how much is in there. And of course then I'm going to put the bed back down, the side rail, all the things that you guys know for closing. But before I do that, does everybody understand now what we're doing to put the Foley in? Please be really careful when you're doing your box, right? That you're not reaching over to like get into your box. It's more really like keeping your arms tucked in and doing the things you need to do. Not touching this down, but rather putting this down when you need to. Yes?
I just want to reiterate too, to be careful with that inch border, because I know a lot of students might put it to the side and then when they, try to take their inner piece off, then they go off their sterile field, so just to be aware of the type.
So you'll notice when I have them together, that's still a 1-inch border, isn't it? But you have to be really careful when you do that you don't do this. And usually these sheets are a lot wider. You guys got lucky. They gave you enough room to put this down, because usually there's not a lot of room. A lot of times you'll have to hang this off the edge a little bit so that you give yourself a little bit of room. Yep.
When gluing the
Yep.
the anchor on for men with a lot of hair, what do you do? Shave it?
I don't know. I've never shaved it.
You just go over there?
Yeah.
Put it on.
Yeah.
That's gonna hurt.
Fine.
Their problem, not. Yeah.
I don't know. I've never seen it shaved. You know, don't forget too that shaving actually causes risk for infection.
Yeah.
So we don't usually shave things if we don't have to.
I don't think I've seen a lot of hair, like, you know, like, I think it's supposed to.
Well, Max just like totally disclosed, so.
I'm asking this question for me.
The lubrication part, you said you put it in the box near the tip. Does it only go on the tip?
Yes.
That part?
Yeah, because as you lube it through, the actual lubrication itself stays like at the urethral opening and goes all the way through. That's a great question. Also, one of the things I hear a lot of nurses saying all the time is to pop this off and to put the tube in there, and you know, it's not really worth it. Just put the stuff in the bottom of the box, put the lube in the bottom of the box, and then do that. Because really, having it in here and popping that off and sticking it in to try and get it back out and playing with it and doing all, just don't do it. Yes. Oh, I thought you had a question.
No, but Brooke had the question.
Oh, I'm sorry, I didn't see
No,
you.
that's okay. So since there's no urine coming out of these, is there like a typical distance that you would advance the, or is it
Well,
everybody's
female
different?
versus male,
Okay.
Yeah.
right? So for a female, your urethra is about
Shorter.
this long. For a male, that's gonna all depend.
Varies.
That varies. Yeah.
said, once you get urine, push it in 1 to 2.
Yes, let me show you why. I'm going to take this off for a second. By the way, please notice that I clapped it in place before I put it on the leg, because once you have it on the leg to try and snap it, you have to snap it against their skin, and that hurts. Let me show you why.
Christina, do you want to show them where to hold it? Because I know sometimes last year they were holding it too far down or like too close to the end.
When you're inserting it,
Yeah, I just.
I'm not sure there's necessarily a distance to hold it,
You know, there's like
but
a couple inches.
yeah, I mean, if you're doing this and it's flopping, that doesn't make sense. And if you're doing this and you're close to it, you're going to get your hands dirty. So you have to use... Let me show you something. So here's the balloon. Do you guys see that?
Uh-huh.
Okay. It's not all the way inflated, but what I want to show you for your question, you'll notice in the tip of this, there's a little hole. Okay? That's where the urine is draining from. So once you go into the bladder, it starts to drain urine, doesn't it?
Uh-huh.
This balloon is still in the urethra. So if you don't go an additional 1 to 2 inches, you're going to blow the balloon up in their urethra. So that's why once you get that, you're going to go another 1 or 2 inches.
Okay.
I personally just know that I want it to be about here, and then I'm okay. It'll migrate when it needs to.
Can you insert it one more time just so we can see which hole? Sorry.
Well, the mannequins make it
Oh, yeah, well, the mannequin's easy. Sorry.
The mannequins make it
I know.
very
Here it
easy.
is.
Durr. Sorry.
That's okay.
It's the first hole on the top.
Yes, it is. Okay. Everybody okay with inserting a catheter? You have another question?
Yeah, what do you do if you meet resistance? Because that's very flaccid.
Well, no, that depends on what department you're in.
Okay.
So if you're with an older gentleman, then you may have to pull that out and get one of those tip of the catheters, right?
Yeah.
The coude, you might have to get one of those. If you're in labor and delivery, you might have to push the baby's head out of the way. So it's just a matter of what department you're in. Yep.
Are we only going to be practicing on females and demonstrating it on a female?
Yes. So let's talk about males. Does anyone have, does Andy have, a penis that we can
I
demonstrate
think
on?
that guy has one.
Oh, does he? I just want to hold it in my hand.
Does he have a ring in there?
Okay.
Let's be done.
I think we're past here.
Yeah, we're all friends now.
Male, you do like the circular.
Exactly.
Like the easiest.